As doctors, we're experts in science and medicine, and with this, we lead the care of our patients. But is it possible to leverage our clinical expertise alongside leadership ability to manage larger systems? Today, we're talking to Dr. Peter Angood, a surgeon by training and the CEO of the American Association for Physician Leadership, also known as the AAPL. Under Dr. Angood's direction, AAPL brings together some of the most accomplished physicians from over 40 countries to further healthcare leadership and practice. All right, let's hear Dr. Angood's take on this. Thank you so much for joining us in DocThoughts, Dr. Angood.
Oh, my pleasure. Thank you so much.
Can you talk a bit more about your transition from working in clinical medicine to going to more of an industry-oriented healthcare leadership role?
Yeah, sure. You know, most all of us start out in our medical training. We're idealistic, we're altruistic, we really want to help people. And then we enter into whatever clinical discipline is appealing for us. And as I mentioned earlier, our educational track is just so darn long that, you know, you're getting spat out of that system when you're 30, 35, some folks even a little bit later. And so it's natural to then want to take a few years to kind of consolidate your clinical learning and your clinical training. But then it's not uncommon by the time you're 40-ish or so that you start thinking, well, maybe there's other elements in this world in my life that are of more interest, because your aperture on the world starts to open up again. For me, I got into mid-career and wound up thinking more about systems, how systems can be improved, how do you create larger scale change in those systems, and was fortunate to get involved with a number of professional societies and then ultimately into some other jobs and opportunities that eventually led me here. But as individuals kind of go through their career trajectory, it's very common for folks to keep a clinical track, gradually assume some sort of administrative responsibilities, whether it's just simple committee work or being more involved with either the medical staff or the administrative work inside of a system. Where you start with your MD, where you go in the early career stage, doesn't necessarily dictate where you're going to end up. And I would just say that everybody should just keep an open mind and recognize that, you know, there's a whole host of opportunities. And the magic of this MD is still there in society. There's something special that society views when you've got this MD behind your name that really allows you to have open doors in a different sort of way than compared to others. So it's a wonderful profession.
What areas of medicine are currently lacking and could be improved upon with better physician leadership?
Well, the one area that always keeps coming up is that how do we better align the payment strategies with the actual delivery models, and how do you align those payment strategies not only for the individual providers, whether it's physicians or other allied professionals, but how do you line up that for the institutional payment strategies so that there isn't this fragmented approach to financing healthcare? If you get those better aligned, then the ability and the continuum of how everybody's behaving in the system starts to get a little bit more smooth, a little bit more efficient, a little bit more safe overall. And so physician leadership really helps to facilitate an improvement in clinical delivery by marrying up the clinical decision-making with the administrative decision-making. And that combination of the two really helps to bring it all together.
What challenges face healthcare leaders today?
Well, I think if you look at the top 10 list, the top 5 list of both clinical leaders as well as administrative non-clinical leaders, really it still comes down to safety, quality, and efficiency. How do we make that better? And then how do you finance the whole thing? And then as well, how do you really engage the workforce in a more holistic, nurturing sort of a way? This is a $3.2 trillion industry. We've got still a 10% major error rate going on in this industry. And by all counts, there's about a 30% waste and inefficiency in here. So compared to other industries, there's an awful lot of room for improvement. And some of those inefficiencies are what are creating that sense of frustration by the workforce.
So this younger generation of medical trainees, they're growing up in a more data-driven and digitally connected environment. What unique perspective can this cohort bring to furthering quality performance in healthcare?
Well, you know, an example of our industry's resistance to technology was the reality that we needed this big infusion of federal funds as a result of the Affordable Care Act to really bring meaningful use into play. there's no other industry out there that's really required an infusion of federal funds to adopt technology. You know, why would we do that? So that's the example of the resistance to it. But now that that's better into place, we're also realizing that the complexity of utilizing electronic health records is not necessarily positive, and it's creating a pressure on the work-life balance. And so what we're appreciating as the younger generation comes through is that everyone is a lot more facile with utilizing the technology, utilizing it in a way that's more of an integrated lifestyle, and it makes it simpler and easier to sort of keep up with the flow and the needs of the information transfers. The medical field, especially within the physician community, has tended to be fairly conservative and sort of top-down, and it's such a long educational trajectory for those just entering into the field. By the time you actually get into practice, you sort of become inculcated with some of these traditional values. Now, having said that, that's the historical way that it's gone. But I would say in the last 10, 15 years, there's been a significant shift in terms of the mid-career, later career physicians really being open-minded and listening to what the younger generation is wanting and needing in terms of their expectations of the career.